Episode 17, Trial and Error, Patient Reports and Compassionate Use. Welcome to Ribavirin Reminiscence and Lingering Load in Long COVID-19. I'm your host Anushka, a genomics enthusiast who spent years unraveling the intricate dance of DNA and RNA to understand how life sport shapes our battles against disease. Today, we step from the realm of theory into the raw, unfiltered world of lived experience. We are hearing from someone who's navigated the shadowy adversary of long COVID and ventured into the uncharted territory of rebavirin treatment. Joining us is Saakshi, a brilliant master's student in microbiology whose passion for microbial dynamics brings a sharp lens to this patient's journey. Saakshi, thank you for sharing the story with us.
Thank you, Anushka. It's an honor to delve into this patient's experience with their permission, of course. It's a story of resilience, hope, and the quest for answers in a landscape still shrouded in uncertainty.
Let's paint a vivid picture of this patient's life before COVID. Who were they and how did this condition transform their world? It's like watching a vibrant tapestry fade into muted tones.
Before long COVID, this patient was the epitome of health and vitality. They ran marathons, traveled the world for work, and had no underlying chronic conditions. But after contracting COVID in March 2021, though not severe enough for hospitalization, they never fully bounced back. 3 months later, they were still grappling with exhaustion, dizziness, and a persistent mental fog. Symptoms like crushing fatigue, heart palpitations, and daily cognitive struggles became their new normal, turning their once vibrant life into a daily struggle.
So, how did ribavirin enter this narrative? Was it a last resort? Or was there a glimmer of hope based on its mechanism, like a faint light in a dense fog?
After exhausting conventional treatments, physical therapy, pacing, supplements, and anti-inflammatories, nothing provided relief. Their infectious disease specialist mentioned ribavirin's activity against certain RNA viruses, sparking curiosity despite skepticism. Thus, they enrolled in a small, off-label compassionate use protocol, hoping it might offer a breakthrough.
Let's dive into the treatment itself first. What was the experience like for the patient while on ribavirin? It's like walking a tightrope between hope and risk.
The patient was prescribed 800 milligram of ribavirin daily for 2 weeks. Interestingly, within the first 5 days, they reported a noticeable clarity. The brain fog that had been a constant companion seemed to lift slightly. However, by the second week, the tide turned. They experienced profound fatigue and unusual chest sensation. Blood tests revealed a drop in hemoglobin, indicating mild hemolytic anemia, which fortunately resolved about a month after discontinuing the drug. It was indeed a rollercoaster ride, with a brief period of improvement overshadowed by significant side effects.
The crucial question, did ribavirin make a difference? Did it even help alleviate the symptoms of long COVID, or was it just a fleeting mirage in the desert of uncertainty?
It's not straightforward. For approximately 2 weeks after ceasing ribavirin, The patient experienced a significant reduction in brain fog and an increase in stamina, even managing to walk a mile without the usual post-exertional malaise. However, this improvement was transient. By 6 weeks post-treatment, they had returned to their baseline state. From a scientific standpoint, this would be attributed to several factors. It might have been a placebo effect, where the patient's belief in the treatment led to temporary improvement. Alternatively, ribavirin could have temporarily suppressed viral activity or even modulated the immune response, leading to symptom relief. However, without control studies specifically designed for long COVID, it's challenging to draw definitive conclusions. It's also important to note that while some studies suggest potential benefits of ribavirin in acute COVID-19, particularly in reducing viral load, the evidence for its use in long COVID is still limited and inconclusive.
From the physician's viewpoint, what justified considering ribavirin for this patient? It's like piecing together a puzzle with missing pieces.
The decision to use ribavirin was grounded in the patient's clinical presentation. They exhibited signs of ongoing immune activation with elevated levels of interferon markers, which are typically associated with the viral persistence. Additionally, there was persistent low-level positivity for SARS-CoV-2 RNA in stool samples, suggesting the possibility of viral reservoirs in the gastrointestinal tract. While these findings are not definitive proof of active viral replication, they do align with the hypothesis that viral remnants or low-level replication might contribute to the symptoms of long COVID. Given this, ribavirin, known for its broad-spectrum antiviral activity and ability to induce lethal mutagenesis in RNA virus, was considered a potential therapeutic option. However, due to its side effect profile and the lack of established guidelines for long COVID, the treatment was approached with caution, ensuring informed consent and close monitoring.
Saakshi, on an emotional level, what did this experience signify for the patient? It's like a fleeting ray of sunlight breaking through storm clouds, isn't it?
For the patient, this trial represented a beacon of hope. After 2 years of relentless symptoms and also unsuccessful treatments, even a temporary improvement was profoundly meaningful. It made them feel less invisible in their struggle. Although the benefits were not lasting, the experience provided valuable data about their condition, which in itself was empowering. However, it also sparked frustration. Why isn't there more rigorous research into such treatments for long COVID?
If another long COVID patient were to ask you for advice on trying ribavirin, what would this patient recommend? It's like navigating a minefield with a map that's still being drawn.
The patient would advise not to embark on such a journey alone. It's crucial to consult with a specialist, thoroughly understand the risks involved, ensure baseline blood work is done, and have a clear plan for when to stop if side effects become too severe. They would emphasize that any potential benefit might be short-lived and that ribavirin is not a cure-all. However, it could serve as a piece of the puzzle in understanding and managing long COVID.
Where does the patient stand now in their long COVID journey? It's like standing at the crossroads with paths still being forged.
The patient continues to manage their symptoms but has redirected their efforts towards participating in clinical trials. While ribavirin did not provide a lasting solution, it definitely offered a temporary reprieve that reinforced their determination to seek answers. It has also instilled a belief that scientific research will eventually uncover effective treatments for long COVID, giving hope to many who are still suffering.
I want to express my gratitude to the patient for their honesty and bravery in sharing their story. And to you, Sakshi, thank you for your insightful and evidence based perspective. It's important to remember that while personal anecdotes can provide hope and direction, they must not be balanced with scientific rigor. The use of ribavirin in long COVID is still an area of active research, with ongoing studies aiming to clarify its potential benefits and risks. Next week on ribavirin reminiscence and lingering load in long COVID 19, we'll explore how ribavirin might influence chronic immune dysregulation, persistent antigen presentation, and post-transcriptomic changes, delving into whether its effects extend beyond direct antiviral activity. Until then, I'm Anushka. Stay grounded, stay hopeful, and stay informed.